If you start treatment before you start having significant symptoms at the time where, as an example, the first sign would be clicking of the temporomandibular joint, you can avoid all of the other symptoms and never have to get into them. But you have to use the protocol correctly. The protocol would be, depending on age of the patient and number of symptoms present already, but the general protocol is 24/7 in the device, 24 hours a day, 7 days a week for 2 months, then nighttime only the rest of the patient's life. And all you're doing there is unloading the joint initially very quickly, and then over a period of time consistently, allowing the inflammation to stay away, to decrease to the point where it does not cause degeneration. It does not cause further ligament damage, loosening of the ligaments, which in turn would then keep the meniscus in more of a normal position. It wouldn't be loose, although once it starts to click, it's always going to click. Clicking is a sign, not a symptom. We can alleviate fixed symptoms, but not the signs. We can alleviate the subjective complaints, the subjective findings, the subjective symptoms, but the objective clicking, once it's loose, it's always going to be loose. Although the locking is a different story. Locking is a symptom. And as I've discussed many times before, the locking under the influence, when the chronic inflammation goes away, the synovial fluid, the lubricant within the temporomandibular joint becomes more lubricative, becomes more like a lubricant, and the meniscus then is able to go back into a more normal position just because the chronic inflammation goes away. Chronic inflammation causes the synovial fluid to get sticky like glue rather than its natural